Okay guys, we're in this patient's left hip. That's the femoral head, which looks great. That's the acetabulum, which looks pretty good. This is the labrum. So he's got a pretty big left hip labral tear, starting to see some of this wave sign, which is chondral delamination of this cartilage. And he's torn his labrum. So we've taken down this pincer lesion. Now it's time for our labral repair. This is all done arthroscopically through 2 really tiny incisions. Okay, so we've repaired the labrum here. You can see 2 anchor repair. This is the femoral head, and you see obviously lots of joint space here because the patient's on traction. So we're going to come off traction now. So there you can see the hip going back into the joints. And this is what we're looking for, this suction seal between the labrum and the femoral head, which has been restored with no abnormal bone anymore along the acetabular rim, which creates stability of the hip joint when this labrum here is intact and it's hugging the femoral head, which is the problem with the labral tear. This tissue here isn't robust and it no longer hugs the head, and that leads to microinstability of the hip joint.